everybody. Good morning, good afternoon, good evening. I think we have a live stream, so I think that covers it. Welcome to Gallup. Welcome to the Great Hall. We're incredibly excited to have everybody here tuning in and joining in person to discuss a very important topic of global diet quality. The center point of what we're going to discuss today is the result of the Global Diet Quality Project. And the Global Diet Quality Project is the result, it actually came out of Gallup's original engagement with the Food and Agriculture Organization that was focused on measuring food insecurity. And of course, the food insecurity measure is attempting to find out whether or not people around the world can fill their bowl with food. And there's kind of a simple but amazing question that flowed out of that. If we're measuring what's in people's, or whether or not people can fill their bowl, shouldn't we also try to find out what's in those bowls? And of course, we all know that diets are incredibly important. It's a huge factor in health and well-being outcomes for people around the world. And it's also known to be one of the #1 behavioral risk factor in death. So very, very important. But then you look at the picture globally of how diet quality is measured, and you realize that on a global scale and at a country level, there's very little data that's been collected historically to understand this important topic. And the reason is that it's a very complex thing to measure, and as a result can become very tedious, very costly, and very difficult to report. So out of that, we basically realized that there's a huge opportunity to totally transform this conversation by providing the world with really simple but highly valid measures of diet quality at the country level that are very, very comparable and can be trended over time. So this group, the Global Diet Quality Project, has been diligently working to build the valid measures, to establish the initial tracking, and we're excited to share what we have. We have an incredible group of partners that work on this with Gallup. It's a true partnership. We work with Gain and Harvard, and we believe that the project will have a huge impact on the way that we discuss and respond to diet quality issues around the world. We're very, very excited that the role of the World Poll can play in this. The World Poll is an instrument that Gallup has been maintaining for over 15 years now. It's a nationally representative survey in over 140 countries each year. I think we've conducted over 5 million interviews, and we leverage that infrastructure and that effort to be able to bring these diet quality measures to everyone. I'm going to introduce our first speaker today. So it's my pleasure to welcome our keynote speaker, Dr. Jess Fanzo, to the stage to share her thoughts. Jess is the Bloomberg Distinguished Professor of Global Food Policy and Ethics at the Berman Institute of Bioethics and the Bloomberg School of Public Health, and the NITS School of Advanced International Studies at the Johns Hopkins University. She also serves as the director of Hopkins Global Food Policy and Ethics Program and as director of Food Nutrition Security at the JHU Alliance for a Healthier World. She has worked as an advisor for numerous organizations and governments, including UN Standing Committee on Nutrition, the World Bank, and the World Health Organization. With 20 years of research and program experience working, her focus is on the impact of transitioning food systems on healthy, environmentally sustainable, and equitable diets, and more broadly on the livelihoods of people living in resource-constrained places. Welcome, Jess.
Oh, I'm very short. This is always a problem for me. Thank you so much to Gallup and to the Global Diet Quality Project for inviting me. I'm going to give opening remarks. I'll try to keep them to 10 minutes so we can hear from the exciting panel that we have, as well as Dr. Anna Herforth. So why should we care about diets? Well, there's a lot of reasons. What we in the nutrition world have known for quite a long time is that diet quality underlies malnutrition in all its forms. No other risk factor looms as large in the global burden of disease. Yet, diet is the only major risk factor for which we do not have a global monitoring system. A recent study just published this past week shows that the chances of having a deficiency in one or more micronutrients, vitamins and minerals, is higher than a coin toss for children less than the age of 5 and for women. In fact, 2 in 3 women are deficient worldwide. That's incredible. Poor access to nutritious food and high quality diets are a major driver of this hidden hunger burden. But accessing healthy diets is difficult. 3.1 billion people cannot afford what is considered a healthy diet, and that work too is led by Dr. Herforth and colleagues at Tufts. And the food we consume are also contributing to climate change and environmental degradation. Our diets matter for the well-being of the planet. So policies and programs that seek to improve human health through diet or influence the effects of food systems on dietary outcomes require high-quality dietary data. But what do we actually know about what people are eating? Crazy enough, not that much. To address malnutrition, environmental sustainability, climate change, and public health more broadly, we need to understand what people are eating, what kind of choices they're making, and how are their eating patterns changing over time. These data have never been available globally. Now, as people are exposed to new risks of food security, and because we are having significant constraints on food systems because of what's called the 3 Cs, COVID, climate, and now conflict, a big conflict between 2 major bread baskets, it's impacting what's called the 5 Fs, food, fuel, fodder, fertilizer, and finance. It's really become apparent that what people eat matters. Current information is vital to identify programs and enable action. So what are people eating? What's the quality and diversity of what people are eating? Is it healthy? Is it environmentally sustainable? It's a real challenge to collect this dietary data. It's costly, resources can be scarce. In many low and middle income countries, it's very difficult to collect that data and to analyze it and use it effectively. Quantitative dietary intake surveys can provide useful data, but they're often not feasible to carry out in countries on a regular basis. So faced with these gaps in what we know about diets, dietary data and uncertainty in modeled estimates, many research simply rely on food supply data and food expenditure data as proxies. These types of data are limited in our ability to understand dietary intake. So the main issue is, do we want to continue on with no data because it's too expensive, because it's cumbersome, because it's difficult to collect and analyze? Or do we want some actionable data? If the answer is yes, and I think we're all here today because you all think the answer is yes, I hope, the Global Diet Quality Project offers a feasible path forward that is low cost and really easy to collect, analyze, and monitor diet quality. So the Global Dietary Quality Project does a few different things. The data is collected in a standardized country-adapted way with a questionnaire, a very simple questionnaire, thanks to the Gallup and others. And it's collected across 29 food groups, asking individuals what they eat the previous day or night. It takes a snapshot of diets in time to help understand how diet quality shifts based on season, shocks like what we're experiencing now globally, and how it varies based on who you are, where you live, and your socioeconomic status. So it provides an indication of diet quality patterns and trends at the population level and can be used to monitor how both patterns and trends are changing over time. In 2021, the project was implemented in the Gallup World Poll to collect nationally representative diet quality data in 41 countries. And if all of you can go to the report, which is coming out today, or maybe it already was released today, and you can find it on the website of the project's homepage. The report is called Measuring What the World Eats. And it offers several indicators that cover what we most need to know about diets, including whether diets are diverse enough and adequate, and what protects or what are the risks they pose for diet-related non-communicable diseases. In most countries, less than half of the population is consuming diets that contain the 5 recommended food groups. That's incredible. The report can spur action, like scaling efforts to increase the availability and access of nutritious foods, boosting key foods like pulses, nuts, and seeds across all countries. Another finding is creating more equity across food systems. In places like sub-Saharan Africa and Asia, animal source foods are incredibly expensive, but they can fill key nutrient gaps. But resource-constrained families can't afford these foods. It also spurs the idea that regulating ultra-processed foods, these foods that are unhealthy and more evidence is suggesting detrimental to human health across a myriad of outcomes, that we need to be thinking about how those are making up large parts of the diets around the world, and they potentially need to be regulated. So now that these data is starting to be collected and shared, what do we do with it? Well, we need to disseminate it in different ways. One is to incorporate the data and litter it across all the major food system databases and dashboards. This is a plug for myself. We have something called the Food Systems Dashboard, and it's on there as of last night. We need to ensure that that data is accessible, open access, and understandable to everyone, from researchers to everyday eaters. This brings me to media. Media can help disseminate that data so people increase their knowledge on the importance of diets for themselves, their community, and the planet. It's important to advocate and use this data, put it under the nose of ministers of agriculture, ministers of health, so they can improve their agriculture strategies, their public health policies, and target and prioritize them in more effective ways to help the citizens in their countries get access to better diets. And I am actually the, pinch hitter, Gina? The person that was supposed to be here was Bibi Giose, who some of you may know from Neufeld. And I'm just gonna quote something that she sent me in the context of Africa and how important the Global Dietary Quality Project is for Africa. The GDQ could not have come at a better time in our human history as we are grappling with multiple crises that render millions, if not billions, of the world's citizenry unable to access and afford healthy, safe diets in a sustainable way. Unfortunately, Africa is not spared of this looming scourge and its horrendous results and harrowing negative impacts. That said, we in Africa are not sitting on our laurels as a continent. And if any of you know Bibi, she's not one to sit on her laurels. So much is happening, mostly positive, and breathing new energy and focus on hunger and malnutrition issues. 2022 is declared by the African heads of state and government as the Africa Year of Nutrition and Food Security. This theme is building on the outcomes of the UN Food Systems Summit, and Africa is really paving the way on what it means to transform food systems. Moreover, the theme for the annual Africa Day for Food and Nutrition Security, being held in Addis at the end of this month, seeks to continue and amplify the Africa Year of Nutrition. Here lies an opportunity to present the Global Dietary Quality Project to the audience for advocacy and dissemination. So that's from Bibi, a bit of the Africa context, and we're really sorry she can't be here today. So let me end by saying the Global Dietary Quality Project and the stellar team that have been working on this tirelessly to put this together as a global good is something that I, as a trained nutritionist, but I don't seem to do nutrition anymore, but anyway, have been waiting for decades. And I'm just thrilled to see it evolve, grow, and be disseminated. Please go to their website, download, read the report, download the tools, which are incredibly easy to use. So I want to congratulate the team. I hope you go out, use it, and it gets disseminated around the world. Next, I'd like to introduce Anna Herforth. She is not only a good friend, she has been an incredible colleague over the last 15 plus years. I've seen her grow from her time at Cornell, where she did her PhD. under Per Pinstrup Anderson and others. And she has been working, toiling on diet data for as long as I've known her. And she's been really fighting the good fight to get diet recognized on the global agenda. And she has done that. She is the lead author of this project, of the report and the project in collaboration with Gain and Gallup, who've been incredible partners with Lynnette and Ty and others who've all contributed intellectually to this endeavor. Anna holds an appointment at the Harvard T.H. Chan School of Public Health in the Department of Global Health and Population, and it is a pleasure to have her come to the stage and present the findings from the report. Thank you.
Good morning, everyone. Thank you so much, Jess. Your partnership and words today are always just what is needed. To speak of toiling constantly for elevating diet, food systems, and nutrition on the global agenda. I think you are spearheading much of the initiatives. There are too many to mention. So thank you for your introduction and kind words. And we are so excited to release these data and the report today for measuring what the world eats. And when I say we, this is a huge collaboration. So not just the three institutions that make up the Global Diet Quality Project of Gallup, Harvard, and Gain, but also many, many partners around the world. Our donors who we could not have done this without, the Swiss Agency for Development and Cooperation starting seeding this work back in 2016 was the initial idea of how do we measure diets around the world, and additional very supportive funders from the EU, GIZ, Rockefeller Foundation, USAID, also linking us with the Demographic and Health Surveys, and the Government of Canada, and so many supporters from the different UN agencies, from Scaling Up Nutrition, IUNS, and Wageningen being a huge partner on the research, that all of these institutions have helped with creating the tools that have now been implemented in Gallup to measure diets of what's representing 2/3 of the global population. And behind, it's not just the institutions as well. It's a global network of hundreds of people in different countries around the world, almost 800 key informants who helped to build the tools that have been used. So huge thanks to everyone who's been involved, and we are releasing all of this work together. As has been noted, diet quality data has been the largest data gap in public health. It's been undermeasured compared to its huge impact on nutrition in all its forms, malnutrition in all its forms, and public health risks related to non-communicable diseases. Poor diets are estimated to cost $3.5 trillion per year globally due to their impacts on malnutrition in all its forms and NCDs. Yet most countries have had no recent nationally representative dietary intake surveys. Some have, a minority of countries. Often this data takes years to analyze, and collecting it typically has required high cost, time, expertise, analytical expertise. So we don't have this, we haven't had a monitoring system for diet quality, and without that, it's been difficult to describe the problem, elevate it on agendas, as Jess was describing, for how decision makers might go about thinking about solutions to poor diets and improving access. We need data to be able to have evidence behind those conversations. The challenge that was articulated at the very beginning of this project about 6 years ago, I think Andy Zeppa here at Gallup articulated this challenge. Routinely collected, globally implemented, internationally comparable, robust diet quality data. That was our charge. And we had lots of advice from our technical advisory group and experts at the very beginning on ways that we might do this. And it became the aim of the Global Diet Quality Project, enabling diet quality monitoring through the collection of data using a standardized tool, the Diet Quality Questionnaire, which I'll describe, that produces a suite of diet quality indicators comparable across time and geographies. So 3 parts of the aim: a standard tool, a suite of indicators, and data across countries is what we are aiming to do. So the standardized tool that we have developed, which is intentionally made fast and easy to use, is the Diet Quality Questionnaire, developed as a tool to rapidly assess diet quality at population level. It was developed sort of fortunately around the constraints of a multi-topic survey, the Gallup World Poll, where the Gallup World Poll was not going to, hire a nutrition expert just for one module of every topic that they covered. We had to have a tool that could be used by any trained survey implementer on any topic. So the way this is designed is yes or no questions about foods consumed in the previous day. It covers 29 universal food groups, but the items themselves are country adapted. And the items are the most commonly consumed foods in each country for each of the food groups. And that's where all of the key informants around the world came in to help us identify those most appropriate items. The questionnaire is read aloud the same way each time, in person or by phone, and it takes about 5 minutes to administer. So this is what makes it suitable to scale up in multi-topic surveys or in sectors where the person implementing is not necessarily a nutritionist. It doesn't involve any probing or any categorization of foods, because that's all done upfront in the design of the questionnaire. The food groups that are included, you can see here, they sort of fall into 3 broad categories of diverse plant source foods, that many of which are important for basic dietary diversity and protection of health against NCDs. Then we have animal source foods, which provide micronutrients, proteins, lots of importance for diversity. We also have them disaggregated in terms of their potential environmental footprints, which we haven't done a lot on yet, but we thought if we're collecting all this data, it would be great if we can eventually use that to say something about environmental impact as well. And then we have foods to limit, and a lot of these are ultra-processed foods, very important because they change quickly, and if we have data that's 10 or 20 years old, the situation may have completely changed on these types of foods. And this is a new aspect that really hasn't been covered well before in efforts to look at in dietary diversity. This is a new addition. And with the DQQ, we're able to produce a suite of indicators, as Jess characterized, as sort of, these are the things we most need to know about. And that's how we designed the food groups. We hand-selected them to be able to reflect what we care about most. And so that's sort of 2 broad categories: dietary adequacy, and then protection of health against non-communicable diseases. So on the adequacy side, we have 2 key indicators. One is the minimum dietary diversity for women, which several of you here in the audience had spent years of time developing, and it's a fantastic effort it was really the first indicator that could be used for kind of a rapid assessment of diet, rather than a big survey of everything the person ate to calculate micronutrients. It's a score that is an indicator related to micronutrient adequacy of the diets for women aged 15 to 49. And we kind of stood on the shoulders of the team that developed that indicator, MDDW, to think about how we could develop other food group-based indicators to say something useful about diet. So the other indicator we use for dietary adequacy is food group adequacy, which we call all five. And it's a very simple indicator of whether any item was consumed in each of 5 food groups, which are typically recommended across many dietary guidelines around the world. And so those are starchy staples, as you know, that's what most people eat every day, but also fruits, vegetables, animal source foods, legumes, nuts, and seeds, as a diverse diet recommended in many countries that would get towards nutrient adequacy and other aspects of protection of health. So this is a new indicator regarding basic adherence to dietary guidelines. It doesn't say anything about the amounts consumed, but if the amount was 0, we know that people were not meeting the proportions needed for dietary guidelines. Then we have the other side on protection of health against NCDs, and this had really been missing in terms of indicators for diet quality monitoring. It is not well captured by the adequacy indicators by MDDW, and it wasn't intended to be. So we added these indicators. First, NCD Protect, which is an indicator related to abundant fruit and vegetable consumption, whole grains, pulses, nuts, and seeds, and fiber. And then NCD Risk, which captures dietary risk factors for NCDs, food groups that are related to consumption of excess sugar, salt, total unsaturated fat, and red and processed meat. And all of those pieces for both NCD Protect and NCD Risk come from the WHO Healthy Diet fact sheet, which articulates global recommendations. And we chose that specifically as a basis for these indicators because it was expressly intended for global application, these recommendations for protection of health. We did quite a lot of validation of the tool before implementing it, starting with cognitive testing of the way questions are asked. So do respondents consistently understand and respond to the questions in the same way? We started several years ago with 82 cognitive interviews in 5 languages and ethnicities, collaborating with Carlos Montero's group in University of Sao Paulo, Pam Koch's group in Columbia University, and really assessed different ways of asking the questions. And from that cognitive testing, we arrived at a low burden approach that was easy to do for respondents, that was, really people were understanding the questions in the same way, which is using a set of discrete food items. If we started asking people about food groups, what we found is that people think about food groups in different ways. Is a potato a vegetable? Is a potato a starchy root? Is a lettuce dark green leaf or another vegetable? So we really got away from the approach of having respondents self-categorize foods and towards asking specifically the foods that they were most likely to have consumed in that setting. And to do that, we had to identify a short list of what we call sentinel foods for each food group in each country. And so then we asked, does that sufficiently capture each food group? And to answer that question, we analyzed a number of national quantitative dietary intake data from several countries that have that kind of data that we were able to use, and found that, in fact, this approach does work well, that the items capture typically over 95% of people who are consuming each food group. So for example, here in the US, if we wanted to know about the proportion of people eating white starchy roots and tubers, we can't ask people that because no one knows what that means. But if we just simply say, did you have potatoes? That will capture over 95% of people who had that food group. And that's how the approach works. So the trick was to identify what are those items in each country. And we did that through lots and lots of interviews with people around the world And then we were able to do a field validation to ask whether the DQQ yields similar results as a reference method of a full 24-hour recall. We did this in 3 countries, Ethiopia, Vietnam, and Solomon Islands. And we did find that the indicators of diet quality calculated from the 2 methods were very similar. And so because we had the right foods identified with the help of all our key informants, and we had the questions asked in a way that were cognitively valid, then we saw the result that the whole questionnaire was valid compared to the reference method. So I want to say a huge thank you to all of our key informants. It took more than 1,000 hours of interviews with over 750 people around the world, done by, there are several of the adaptation team here in the room, Chris Voliano, Cecilia Gonzalez, Betul Uyar, Andres Brebulungu, and Christina Sokorenko. Fabulous team doing these interviews. We Zoomed all over the world to talk to people with lots of support from many organizations to identify the key informants. So thank you for building the tools together. All of the tools that have been developed with this global collaboration are up on the website. They are meant as global public goods. So the initial motivation was to collect the data in Gallup, but they're not just for Gallup, they're for everybody, for governments to be able to pick up and adopt. They have been, in many cases, already inclusive of input from the government agencies to build the questionnaires, and they are ready to use to simply download at the DQQ tools link. We hope that helps to scale up the measurement of diet quality in consistent, comparable ways. So I'd like to talk about the data now that we did gather in 2021 in the Gallup World Poll. We gathered data from 41 countries. There are 13 more on the way from this year. And then the countries shown on this map in light blue, we do not have data yet, but we are ready to go as soon as we can start to add more countries. We have the DQQ adapted for all of the countries shown in any shade of blue, and we are trying to fill out the rest of the world as we go. This is the report, which is now up on the website. You can download it at dietquality.org. Ty Beal was leading the analysis behind this report. Gina Kennedy also was a co-author. We worked very hard on this for the last few weeks, so really happy to be able to share it out. The results here are covering the 41 countries in the 2021 data collection round. These 41 countries cover they represent 2/3 of the global population. And in actually well more than half of the countries, these are the first nationally representative diet data in the adult population ever collected. So here are some of the results that come out of the data collection and that are featured in the report. For minimum dietary diversity for women, this is the first MDDW database that you can go to and access to see what's the MDDW prevalence in the countries where it was collected. And again, this has renewed relevance from the report that came out on Monday, showing that 69% of women aged 15 to 49 globally have at least one micronutrient deficiency. And what we find in these results is that less than half of women are consuming MDDW in many countries, including India and much of sub-Saharan Africa. So really, lots to be done on minimum dietary diversity. And this approach of using the country-adapted DQQ, it also addresses issues of data quality and capacity that we'd heard from people in country who had committed to measure this indicator in particular in the country, but were facing problems in how to do so and get high quality data. So in one country, we heard that the people who collected the data were not experienced enumerators, and there were too many gaps in the data collected for it to be useful. This was before the DQQ has become available. We heard that measurement errors were an issue. We need to not only promote the indicator, but ensure there's adequate capacity at country level to measure it well, the DQQ can avoid the longer food lists of existing national questionnaires. So it's the same indicator that people have in some countries pledged to monitor, but providing a way to do this in a much easier way. Then when we look at the all 5 indicator, we find that most people in the countries surveyed are not eating diets that would even minimally follow dietary guidelines. Because again, if no amount of the food group was consumed, then the person definitely did not meet the recommended amount. We know from the statistics that now FAO has published in the State of Food Security and Nutrition in the World, 3 billion people cannot afford a healthy diet. We would love to have data globally to be able to answer how many people are not consuming one. And the all 5 indicator that we use these 5 food groups, it's meant to be globally comparable. So we have an indicator across countries, but it's not the same 5 food groups in every single country that has their own dietary guidelines. So this indicator can be adapted for country-specific use, reflecting the country's own guidelines and food groupings. So for example, India has slightly different food groupings than these 5, and using the DQQ data, we can find out how many people specifically did not meet India's food group recommendations. We find 12% of Indians only are consuming all the food groups recommended in India's My Plate for the day. Turning to the dietary risk factors for NCDs, we see here, looking at the income levels of countries, that as the income level of countries go up, dietary risk factors for NCDs increase quickly with national income, while health protective factors increase slowly with income. So we can see here, based on these new indicators, we can be able to use them for tracking trends related to public health risks from diet-related NCDs. And the indicator NCD risk, the one in light green, is also correlated specifically with ultra-processed food intake. Again, Carlos Montero's team has been building a huge research base around the impacts of ultra-processed food on nutrition and health, as well as other researchers. So it's an important aspect that's captured by this indicator. And when we look at individual income, a measure of income, at people who had enough money for food versus people who reported that they did not have enough money for food, we see that higher individual income does not guarantee better diets in all ways. We do see that people who had enough money for food have higher adequacy in terms of food group diversity and all 5 score. They also have more health protective foods in terms of NCD Protect score, but they also have more unhealthy foods in the NCD risk score. And so when we look at the combined global dietary recommendations score, looking at all of those WHO recommendations for health protection, the result is not that different between those who had money for food or did not. So income is really a double-edged sword when it comes to diet quality. It's increasing all the kinds of foods, so that leads to some policy discussions and agendas. I also want to note we very carefully designed these indicators and the tools to be aligned with what WHO and UNICEF have published for indicators on infant and young child feeding. Now, the Gallup data covers people age 15 and older, so not this age group, but the indicators are aligned with the same indicators used for the infants and young children, including specific dietary risks of 0 vegetable or fruit consumption and sweet beverage consumption. For adults, we operationalize this as sugar-sweetened soft drink consumption. And our team worked very closely with DHS. I see Sorrel Namaste here in the room. We work closely together on the diet question adaptations for both the IYCF and the women's questionnaires in DHS so that it's aligned with the data we have collected from Gallup. And these questionnaires are available as well. One of the unique things about the Gallup data is that we can see gender disaggregated data because we're collecting data from both men and women. And that's really important in certain indicators of diet quality. So for example, sugar-sweetened beverage consumption, we see big gender differences where in many countries, the majority, significantly more men are consuming soft drinks than women. So if we were to only collect data on women of reproductive age as our only source of diet data, we wouldn't be seeing the trends in the total population for all of the indicators we're interested in. We can also look at urban-rural disaggregated data. We see here that predictably there's more unhealthy food consumption in urban areas in many countries, but that's not always true. So again, for example, one of the surprises was to see that in India, for example, there's no difference between the rural and urban areas in instant noodles and packaged snack consumption. That's an interesting area for policy relevance as well in terms of the reach of some of these ultra-processed foods countrywide, not just in the urban areas. As Jess noted, these indicators are now up on the food systems dashboard. The dashboard enables us to look across the food system at food supply data, food environment data, and now having this diet data as well to look at some of those relationships within countries, start to see what is behind some of these diet impacts that we see on a systems level. So thanks so much to the whole dashboard team, particular Jess, for getting these indicators integrated immediately into an actionable resource. In conclusion, the results we see, I think they really demonstrate that it is possible to monitor diet quality. The results and data we have here are publicly available less than a year after the data collection was completed. And the DQQ costs quite a lot less than 1% of the cost of a full national quantitative dietary intake survey. Again, these surveys very useful. We would like to have them everywhere, but probably not possible, at least in the short term. So what can we do? Something a lot lighter to give us some information. The DQQ requires very little training. It's simply read aloud without any further adaptation. All the work is done upfront by this global network of key informants. And so it really offers a path forward for collecting comparable data and actionable insights towards improved diets, nutrition, and health, which we hope will help with the agenda set by many countries. That of the 110 countries preparing a UN Food System Summit paper, 79 of them listed healthy diets from sustainable food systems as one of their top priorities. This was just last year. So how do we get there? We need data to inform where we're starting, what needs to be done. Hopefully this offers a path forward. Thank you so much to everyone who collaborated and made this possible. And I'll end here and begin turning it over to the panel for discussion. Thank you.
Thank you so much, Anna, for that really fantastic, comprehensive overview of the report that has just been released on these 41 countries collected from the Gallup World Poll data. I'm Gina Kennedy, and I'm a Senior Technical Advisor with GAIN, the Global Alliance for Improved Nutrition. And I'm super excited to introduce this esteemed panel of experts that we have with us today to give their insights on why they feel from their own perspective diet quality is important, how they think it will be used in the organizations they come from, and what relevance does it have for policy and uptake. So pleased to introduce Faiz Rasool, who's a Senior Policy Advisor with the Global Alliance for Improved Nutrition. Faiz is really bringing a country perspective from Pakistan, where as a policy advisor, he works very closely with the Ministry of Health and is very aligned with their policy perspective, and will also bring some remarks from that he's received from the ministry there. And next we have Lynnette Neufeld, who is the director of the Food and Nutrition Division at the Food and Agricultural Organization. Lynnette, of course, brings the very important United Nations perspective with her, and how this type of data is important from a global perspective and how it might be used. And then we have Julius, who is a digital agriculture innovation consultant with the International Institute of Tropical Agriculture. Julius brings this fantastic multidisciplinary perspective as natural sciences and geospatial applications and data innovations in agriculture, and how they can be applied to this type of data, nutrition data. So Julius is also from Nigeria, so we also have another perspective there. So let's just start off with one question for each of the panel members to reflect on, and then we're going to do a blended question and answer with the audience. So be thinking of your questions, and be thinking of who you might want to address your question toward. And I'll ask some questions from my perspective and take some questions from the audience as we go along. So just to start off with, we'll go Faiz and then Lynnette and then Julius. Can you just tell us why you think we need global monitoring of diets from your own perspective in your own research field or your own country? And what's the value added of collecting information globally on diet quality? And the microphones are there in between the tables. Yeah. Thank you, Faiz.
Thank you so much, Gina. It's really a pleasure for me to, before giving the reflections over the need and use of DQQ and the report, it's a pleasure for me to give you a reflection and scenario in the landscape from Pakistan, where we are living in a situation. We are facing serious trouble and constraints regarding malnutrition. We are facing serious trouble on food security, unfortunately. And both of these different perspectives, how we are really able to reflect that the need for data on food quality, and the behaviors on consumption would be helpful for us to improve our landscape where we are working. To give you a reflection in a very close manner, Pakistan is a country where we are facing a stunting. 40% of our children are stunted, unfortunately. On the other hand, if we look on wasting, almost 18% of our children are facing this trouble of wasting. Moving further, you would be amazed to know that our women, more than 41% of our women, they are dealing and having the challenge of anemia. So under this situation, how this is reflecting and coming down into what are the key logics behind that, and how we are facing the trouble of NCDs. Under this, you would amazed to know, and it's really a big issue for us also, that more than 41% of our population, either they are obese or overweight. Unfortunately, 37% of the population is hypertensive. So this is a broader reflection of the population. And if I share the data on type 2 diabetes, you would be amazed to know that we are the third most burden creating country around the globe. 33 million people from Pakistan, they are suffering from type 2 diabetes. So this is the whole scenario. But the positive thing is this, that the last year UNFSS 2021, that has came up with a pathway that gave us such a wonderful direction within the country. When we had national and sub-national level dialogues, that set us some reflection and direction for the country to think about and move forward for the identification of new solutions and work on that. And then under that, there are 7 different thematic areas on UN food system pathway from Pakistan. And one of them is the healthy diets. Second is the dietary diversity. And when you will look into the details, and we had a presentation from Jess and Anna, that's showing a reflection that how these healthy diets context could be a serious constraint for the country, or it could be a wonderful situation and scenario to improve the overall situation of the countries. So having this in front of us, I'm working very closely with government of Pakistan, particularly the Ministry of Food Security and Research and Ministry of National Health Services. And we are very much happy. We are very much appreciative to Ministry of Health that they have wonderfully visualized and supportive and provided leadership to two high-level consultations. One was on healthy diets consultation, and under that, Pakistan is one of the country which has already signed the coalition of healthy diets at the global level as a result of our deliberations on UN Food System Summit. And after that, we had a wonderful findings sharing on our diet quality tool. At this diet quality tool finding sharing, this really was taken in such a wonderful way by all the stakeholders that when we ended up with that, Ministry of Health, they formally invited GAIN to work with them. This diet quality team, they requested global diet quality project team to support Ministry of Health to work on a national healthy diets policy. So I think this is something which is a wonderful situation for us, and we would definitely like to appreciate GDQP team for supporting us and helping us out to find out a solution to work in the country and to move forward. Thank you so much.
Thank you, Faiz. And now we'll hear from Lynnette on your perspective about global monitoring of diet quality.
Thanks very much, and thanks for the invitation to be here. It's great to see all the friends and colleagues. So I would really like to make 2 points related to the data. First, we already heard from Jess about the importance of global monitoring. Global monitoring is a critical way that countries, donors, partner organizations can track progress towards commitments made. It's a critical part of holding ourselves to account for what we value and for what we commit to improve. In this regard, we know that SDG 2 and hunger is tracked through a series of indicators, including calorie availability, food security, the prevalence of various forms of malnutrition, and a number of agriculture and related indicators. But the critical intermediate outcome that ties all that together, which is healthy diets, is conspicuously missing. We need to reset our understanding of what we mean by ending hunger to reflect not just full bellies, but rather nourished people. So again, diet quality, healthy diets is that link. We cannot track progress towards healthy diets and global targets if we don't have metrics that are comparable across contexts and over time. Nor will such metrics be accepted and adopted by countries if they substantially increase the already heavy burden of reporting by countries for SDG indicators. The D2QQ project has taken us a much closer to meeting that need and that goal. So the second point with regards to this, inevitably, in seeking that comparability and that simplicity, some critical and nuanced information about healthy diets is excluded, such as nutrient adequacy and the quantity and frequency of consumption of some of those critical foods that were mentioned, such as those that are associated with poor health outcomes and positive health outcomes. These concepts that are a core part of national and global guidance, specifically moderation in the first instance and abundance in the second instance, cannot be captured in simple approaches such as the one that we've heard. The implication being that going beyond global monitoring, which is critical in itself, but going beyond that to policy development, program planning, measuring impact of actions in specific contexts, these details are critically important. So it's my hope that the glimpse into what the world eats and the enormous challenges and room for improvement that we have observed today will indeed motivate more and better investment in countries to generate that data needed that will give us that holistic understanding of dietary patterns, the specific constraints that people face to consuming healthy diets, and to gain the deeper understanding of actions that are needed and are effective to improve them. Thanks.
Thank you so much, Lynnette, for that great perspective. And yes, the floor is yours, please, Julius.
Well, thank you so much, Gina. And it's a great pleasure to be here and to be able to share with the audience. Um, to answer your question, I'm going to bring up a story that I think we're all familiar with. The whole world got hit with COVID around 2020, and there was a lockdown. And our team had been working on collection of food price data prior to COVID. So we had the data on food price, food commodities, and we're able to tease out the aftermath or the effect of the lockdown on commodity prices, not just anecdotally, but actual data-driven evidence that shows that commodity prices rose as far as 60% or even 65, 70% for some commodities. But then we didn't have the data on nutrition, and we don't have an understanding of where exactly there could be a compounding effect of COVID itself, COVID effect on food prices, the fact that people's income and livelihoods were getting shut down by the lockdown. And it became a critical question for us. So my team and I, we started to think about, okay, what's happening with food nutrition and what's going to happen to food security or insecurity across especially developing countries or low and medium income countries. We started to tinker with the idea that we could collect data, but it doesn't exist. We could collect data on food system and understand the dynamics, the changes in food consumption in space and in time. And we know that we have the technology to start to advance this kind of thought, but we don't have the full expertise. So eventually we plugged into the DQQ tool, which really helped us to get things off the ground. Barely within 4 months, we started to collect data on a weekly basis to understand the shift in food consumption, the shift in diet, and how that is changing at a subnational level. Global diet data is a goal that we really need to be able to understand how our world is changing, how stressors and shocks are impacting livelihoods. Annette had already mentioned the fact that SDGs are all dovetailing, or they have an element that is focused on food and nutrition. But the point is that we have the data. So it's important for us to have the global data on food and nutrition so that we can truly articulate where exactly interventions are needed, where exactly we could derive maximum impact for a dollar that has been invested by donors, and actually to eventually deliver the sustainable development goals that we all talk about and we're on a journey to achieve. Thank you.
Thanks so much, Julius. So thanks, Faiz, for reminding us of all forms of malnutrition experienced in Pakistan, as well as the government's commitment to address how diet quality can improve the situation. And Lynnette, for reminding us that this is a glimpse of diet quality that has been much missing in our monitoring systems, but that we have some hope to gain better information that will inform food security and SDG monitoring. And thanks, Julius, for that really practical example of how timely data was useful in connecting the dots and how you're looking at food systems and how you're doing it in such a rapid way. That's very interesting. So we can take some questions from the audience, maybe 1 or 2 to start off with, and then I'll ask each panel member some different questions. If you have a question, please think who you'd like it to be addressed to, and just raise your hand, and somebody will pass you the microphone. So.
Thanks a lot. My name's George. Thank you for this amazing amount of information. I'm going to steal your questionnaire and give it to my dietitian. Thank you so much. My question is, how do you factor in things like government policies? In the United States, our government is about food choices. They are not about healthy food choices. Do you consider factoring that in possibly a future version? And then I guess the other question that I want to ask is related to, let me post that one. Let's just do one question.
Okay, so thank you, George, for that question. Did you have anybody in particular that you wanted to hear from, or, okay, it's up to me. So why don't we start off with Lynnette telling us a little bit about how she thinks, the UN might use it, and then maybe Julius, since you have the experience also with working with the data. So please, Lynnette. George's question about how you think it can be, you want to say,
Yeah.
George?
Well, let me just say two, because I remember the other one. The first question is, did you factor in government policies related to food in diet? And the other question is, sometimes a person can have healthy choices, but they don't choose healthy. How do you factor that into the food quality?
So kind of just speaking about consumer choice and consumer demand for healthy and less healthy foods.
Yeah, I think you're raising a very important point there. And that's one of the areas where I hope this information will motivate greater data collection, because what we see here are what people are reporting that they consumed, not why, right? And that if we want to change dietary patterns, we do need to understand why people choose the foods they choose. Might be economic and availability and access. It might be principles. They may be choosing food related to their values, but not health values. They may be environment values or other values. It may be traditions. It may have an element of health as well. But there are so many factors that influence our food choices. And so that is one of those areas that are really fundamental to understand and do need the contextual nuance of where you're working. Because while here we're capturing a pattern and it's easy to adapt a questionnaire in this manner across multiple contexts, you need a different kind of data to understand food choice decision making. And then very briefly on the policy, I think, again, this didn't collect that data. There are data available that try to capture what policies relevant to nutrition, food, and food choice and diets. There is a database held at WHO called Gina.
Yeah.
Gina, do you know
Yes.
what Gina stands for?
Generating information for nutrition action.
Exactly, the Global Information for Nutrition Actions database. They do try to consolidate and compile that there. So I think, again, it's important to think about this as one of the many, many resources that are out there that can help move this agenda forward.
Yeah, great, thanks. Do you want to say any, Anna, would you like to respond?
Yeah, I could add to your comment about incorporating government policy around food and nutrition. That sensibility was behind the choice of how we determine the indicators. So the indicators are structured, the tough thing was, how do we create something that's globally comparable? What are the things that governments around the world have said in common? And that's what we capture in the indicators chosen. So the MDDW on women's dietary diversity has been something accepted by a lot of countries and promoted by the FAO. The All 5 indicator represents common food groups recommended by most countries. The NCD Protect and Risk represent the WHO guidelines, which are meant to be globally applicable. And so we did have that political sensitivity in the way we built the indicators. Now, the countries themselves can then take the food group information and create their own indicators, which are relevant to their specific policies. For example, the US Dietary Guidelines for Americans, Gina's going to talk about this afternoon, how we've modified one of the All 5 indicator to represent the US Dietary Guidelines for Americans. So that can be done. And then I also just want to say, again, the food systems dashboard gives a tool. It gives some ability to look at, as Lynnette was saying, there's all these factors that influence food choice, and we need more data. But we have a lot of data compiled on the food systems dashboard around food environments and what sorts of foods are available, and the affordability of different kinds of foods, marketing of the availability of ultra-processed foods. So I would say that's a good tool to start with for some of these pieces of information.
Thanks, Anna. And that was a good segue into one of the questions that I have for Faiz, and it answers your question also a bit, George. We know that Pakistan is interested in developing a healthy diets policy. And we'd like to hear from you, Faiz, how you think this is going to develop and what are some of the ways that this data on diet quality could help that aspiration of Pakistan.
Thank you, Gina. And thank you so much, George, you raising very important aspect in context of policies. I may not be able to speak more about US policies, but I would be very happy to share with you the constraints and the situation what we are facing in different parts of the world, like from Pakistan. When we were having a scoping on our existing policies, I will share with you a very interesting example from Pakistan that after very soon after our UNFSS Food System Summit, when we submitted our food system transformation pathway from Pakistan side, we realized that our policies, either it's a food security policy that was made in 2018 till 2023, or we other policies, like we do have a nutrition strategies in country. But after that mapping and that scoping, we realized that there are certain important areas, those are not being covered by these policies. For example, we do have a national food security policy, but gender and this climate was not being addressed by that policy. It's amazing. We do have multiple type of strategies on nutrition, but unfortunately, even after 75 years of the age of country, we don't have national nutrition policy in Pakistan. So this mapping giving us some reflection. I would say this UN Food System Summit actually opened up a kind of, a thought process within not only policy makers, but also the other people, those are linked with this different program designing, that how much important would be to have a relook into our existing policies. That would be the time, George, that our policy would be more linked, more directed to our challenges, what we are facing these days. Thank you.
Thank you so much, Faiz. We can take another question from the audience if you want to raise your hand. And yes, and if you could direct your question to one of the panel members, that would be fantastic.
Thank you. Yeah, Jess, RTI International. Whoops, can you hear me okay? Anna, this is my question for you, but others can chip in as well. First, thanks and congratulations. It's just amazing, I think, what you've done. I think I first heard you talk about this like way back when, and it's just remarkable to see how far this has come along. And so I really appreciate it. I also appreciate that given how Gallup implements its polls, by definition, you're only going to get information on 15 years and above. And it's incredible that you're also getting information on men because that's been lacking. But I think as those of you I know here, I've worked always on infant, young child nutrition and feeding. And so by only getting that segment of 15 and older, we're missing what's going on with the youngest and most vulnerable. And specifically, for me, it's hard to think about diet quality globally without thinking about the contribution of breast milk, for example, but there's other indicators, which you specifically referred to. So my question is really, have you had any discussions like with UNICEF, DHS, because they collect these indicators and some of these really key ones in the same countries. And so, putting them into your dashboard or having a collective dashboard or just taking what you have, which is incredible contribution, but linking it to other sources of information that provide, what can I say, the complement incredibly what you're doing. Thanks.
Thanks, Chessa, for that great question. Anna, that's to you.
Thanks, Tessa. Nice to see you. And speaking of a person who's done groundbreaking work on infant and young child nutrition and the principles of young child feeding, we have been working very closely with DHS, and UNICEF's been involved. So in the adaptation work where we talk to people around the world to build the questionnaires, a lot of those key informants were pointed to us by UNICEF and by DHS specifically for their expertise on young child feeding. So we specifically asked and had input from people in all of the different countries where we have DQQs around foods that are common complementary foods, and the other questions that are adapted specifically for the infant and young child age group, such as common brands of infant formula and breast milk substitutes, or food items that might have been fed to infants in the first 2 hours after delivery. So there's some specific infant and young child feeding questions. And we do have on the website, we have infant and young child specific DQQs, which not only match the same food categories as the adults, but they also incorporate those other WHO and UNICEF questions. And with Sorrel and Rukundo at DHS, we've been working closely together on making sure that we have the question adaptations aligned that DHS is using in collecting their data. And so we'll be able to look at the infant and young child feeding indicators and data collected by DHS, collected by UNICEF mix, and then have that data, which would be great to look across the life cycle. We'll have the minimum diet diversity for 6 to 23 months from those data sources. Then we'll have the minimum dietary diversity for women from Gallup, and then DHS will also have that coming out over time. And so on the dashboard already, we have the ones that UNICEF has published. You can go there and find the minimum diet diversity for infants and young children. But yeah, so thanks for bringing that up. We do want there to be consistent data across the life course, and so are really building on what's been there already from WHO and UNICEF and DHS's operations.
Yeah, thanks so much, Anna, for explaining how the diet quality questionnaire is aligning with the WHO and UNICEF infant and young child feeding indicators to the extent possible, and also that Food Systems Dashboard will be the one-stop shop for looking at all of these data across infants, young children, adolescents, and adults. We have time for maybe one more quick question. Yep.
Hi, I'm Quinn from the International Food Policy Research Institute. First of all, big congratulations to you guys. I mean, I think everyone should understand that this is not an incremental improvement. This is really a watershed moment for diet data availability. Just seeing those bar graphs you showed in your presentation, Anna, I think that's something that we've been waiting for a long time. My question is around I guess the stability of the sentinel foods over time. Do you envision, I mean, and you should be allowed to rest on your laurels for a while, in the words of Bibi, but it was a lot of work, I know, but do you envision, 5-10 years from now, needing to kind of revisit those sentinel foods to see if they still capture 95% of the people that are consuming those food groups? And I guess also the short-term stability, which I think is especially relevant today with so many shocks happening. We have global economic crisis, the crisis in Ukraine, foods like wheat flour, which are probably really important in a lot of countries, is becoming really expensive. People are probably having to substitute, among different food items within these groups. And maybe this could be a question for George because of the example he gave. If a country wanted to adapt the DQQ for that type of, more regular monitoring and in the presence of shocks, would they be able to maybe come up with another list of sentinel foods that, people use during lean seasons or when food access is low?
Thanks, Quinn. So Anna, if you could answer quickly in 1 minute or less, and then we'll have closing remarks from the panel members. Thank you.
Thanks, Quinn. On the sentinel food issue, I think that it's a great consideration about how they'll be updated over time, and I think that's something we'll need to consider over the years to come. I don't think it's going to be an immediate issue because a couple of things. One is that when you think about a short list of foods for each food group, it seems like seems like maybe that has to change a lot. It would be very sensitive. But if you think about it, there's 29 food groups, and the questionnaire actually, typically for a country, it covers like 120 different food items. So there's really a lot there. So there's a lot of space for movement in trends already captured in the food list that probably won't change very quickly. The only thing that probably is subject to change is some of the brand names. We try not to use brand names as much as we can. We try not to, but in some cases they're critical for understanding, such as Coca-Cola is an example of a soft drink, you know. And so some of those brand names may shift over time, and I think that's where we want to look and make sure we check in after a few years on more of the ultra-processed foods. So hope for some collaborations to make that easy to do over time. Also, we know that from countries, inflation monitoring, they regularly update food lists. But often when we see the changes that are made over time, like every 5 years or every 10 years, they're not very significant. So that gives us some evidence that food consumption stays fairly stable over time. We should be pretty confident in using this at least over the next several years to come. Thanks.
Thanks, Anna. Great response. So now we're going to hear a closing remark. We'll go Julius, Lynnette, Faiz. And if you could just tell us what you think are the next steps needed for diet quality data to actually inform action. So who is this going to inform and how? And just 1 minute wrap up would be great. Thanks.
Sure, thank you. So first thing, from my perspective, innovation is always an evolving process. I really believe that this is a watershed accomplishment for diet quality monitoring and tracking globally, but I also think that there's a space to actually even grow further. Currently, the DQQ has been deployed in 40 countries. There are possibly 100 more countries where this can be applied. So I really think that three things need to happen moving forward from here. Number one is to engage. Constant engagement of the citizens, of the government, of the private sector, private and public sector actors. I think that's very critical. The second thing is I think adaptation is a constant thing that needs to go into this tool. I believe, to the last question, that there's a transition in our diets, even in America or in Africa, as people get more income, they're switching out the food or substituting the kind of food that they eat and the pattern too. So I think that's something to take cognizance of in this tool, you know, as it moves forward. I think the last thing is to actually focus on delivering not just the tool, but delivering the results, not only to the government, but also at the individual level. So there are opportunities, technologies to deliver, for example, recommendations to individual, to households that helps them to make better decision. Just like we don't make decision or learn things just off one information, one recommendation. We are constantly trying to find out if it works for us and trying to make decisions based on how our knowledge evolves. So I really think those three elements, engaging, adapting, and delivering, are critical to move this forward. Thanks.
Thank you, Julius. Yes, please.
Yeah, I hope I can be that concise. I want to really make 2 points, and I'm going to struggle to make sure I can do that. So first of all, in terms of informing actions, I think it's really important for us to work with countries, colleagues, partners to understand how to use this data. The data itself is only as good ultimately as the way it is used to inform and to make things work better and to track progress better and so forth. So I think it's really important for us to take into consideration that there are countries that have used dietary data, in-depth dietary data, to inform their actions. And while their methods have varied vastly, they have deep experience in how do you do that? How do you actually get policymakers to do something different based on that evidence? And there's not a lot of experiences like that, but there are some really good experiences. And it's a little bit of a pitch. I would, if you're interested to see that experience, I'd just like to draw attention to a report that was published. I take no credit because this happened long before I joined FAO, but it was an joint FAO intake report, and it really qualitatively captured the experiences of countries that had collected and utilized data for different policymaking approaches. And I think it's just reading that through and understanding how to generate those dialogues is a really important next step. You've got to get that data beyond the report into the policy making, the hands of the policymakers, and into the room where those debates are happening. And that report, I think, provides some nice experiences on how that's happened. And then the second point I want to make is that getting everybody on the same page about data and why and how we use data for different purposes is really important. And we in the nutrition community haven't always spoken with a strong and clear voice and consistent voice. And we haven't always brought a clear and consistent message to countries on how to do that. And that's problematic. If we go in different groups and different agencies, including within the UN, and say different things in different moments in different venues, that's really problematic. We compete with each other, we contradict each other, and ultimately we decrease the possibility that people will take up the message and move forward. And so we had a lot of discussions in the last few months with our sister agencies, UNICEF and WHO, and we decided that we really needed, with this being one of the inputs, but many other things going on as well, to generate, to convene what we're now calling a Healthy Diets Monitoring Initiative, where we will work together with partners as 3 UN agencies, and over the next months and hopefully not too long, but months to years, shall we say, really ensure that as a nutrition community and as all of the linked communities that are working on this important topic, we help build that consensus on the core principles that constitute a healthy diet across contexts. What purposes do we need data for? And what are the ideal data sources for all of those different purposes that we want, including global monitoring, including informing actions, evaluating the impact of actions over time. So more to come on that. And many of you have already received invitations to be a part of that. And we're really excited about that as a next step. Thanks.
Thanks, Lynnette.
Yeah, Lynnette, I think great point. I'm building upon the clear and consistent data which you mentioned. I think considering the grassroots level situation, I'm again coming down to Pakistan situation. So in that context, we have been identified that serious challenges have been with the data availability in different contexts, and particularly the diet quality of data. This has been a serious concern for we people. But the recent developments, those started with the UNFSS summit, and recently when we disseminated the findings of diet quality data survey for Pakistan, because Pakistan is one of the 41 countries where we completed this data, and we also disseminated data within the key stakeholders. When we had more than 50 public sector stakeholders with us across the country to share with them the data findings on diet quality, we were amazed to know that how much they were interested to further dig out the data, how much they were interested to finally kind of tweak this tool and use in their own context. I have few examples, very interesting examples, like Pakistan Bureau of Statistics. Their director after that meeting came to me and they said, this is a wonderful tool, and this is so simple and so quick tool that in 4 to 5 minutes we can have one questionnaire completed, and we can use this tool, we can tweak this tool, and we can use this tool in different our data collection activities. So a wonderful, I think, next step. And another way, I would say that this is really a way where we have been thinking about transformation on food system. So this is a step forward on that how this transformation would be helping out at the grassroots level, where we are facing the challenges because of number one, scarcity of data, and number two, use of data for the improvement of overall indicators. Another example I would share very quickly, when we invited different stakeholders to share with them our DQQ findings, we got a CSO there, and that CSO they have more than 1,000 members across the country. Those are all food technologists. And just after this discussion, they started their own, using this diet quality tool in their own areas to identify that how they can really get the data in from different parts of the country to understand that what is happening across the country. I think this is a wonderful use of such kind of data tools. And we hope this is a great step towards what we used to say the food system transformation and the diet transformation. Thank you so much.
Great. Thank you so much, Anna and Julius and Lynnette and Faiz. In the interest of time, I will introduce our closing speaker, who will provide closing remarks. We're so pleased that Dominique Favre has agreed to join us. Dominique is the alternate executive director of the World Bank, representing 9 countries. So please, Dominique, you're welcome to take the podium. No,
Thank you so much. I will be quick, but I'm not here in the capacity of the World Bank. I'm here in the capacity of the Swiss Agency for Development Cooperation. You were mentioning it, Anna. The Swiss Agency for Development Cooperation is supporting this project, actually has been supporting it from the very beginning. And unfortunately, my colleagues, Alessandra in particular, could not make it. So as I live here and as I'm also from SDC, but working at the World Bank, I jump in. So that's why I'm here. I'm extremely delighted to listening to this morning's presentation. Maybe if you allow, nevertheless, a small bracket on the World Bank, because I'm sitting in the board of the World Bank. We approve now, I think, for the 15 months, up to 30 billion investments in food security. In the board, I always insist on nutrition, and I can definitely tell you that now I have the data, I have figures that I can use, thanks to your fantastic work. So I will disseminate this, the results of today's presentation and the report in the board. So why does Switzerland support the project? Actually, there are 3 reasons for that I would like to mention now. First, and you heard it several times today, because unhealthy diets and diet-related non-communicable diseases are one of the world's most serious but least addressed sustainable development challenges, impacting tremendously human and planetary health and undermining economies in all countries. It is thus essential to monitor diet quality, to transform policy and action to deliver more sustainable and healthier diets for all, and in particular for the most disadvantaged and most vulnerable populations. Second, Switzerland appreciates the pragmatic approach of the researchers who designed a tool which captures credible and robust data while breaking down the barriers to diet quality monitoring with country-adapted surveys for minimal cost and efforts. And let me hear Anna, but also all the people you mentioned, and probably also those who are not in the room, congratulate everyone again for this tremendous work. The project is also in line with the international development community goals for open data, transparency and accountability, since the survey instruments, knowledge outputs, everything is free to access and easy to use, conceived, as you were mentioning it, a global public good. The third reason, the Global Diet Quality Project offers much needed new input. For example, data to track nutrition transition trends with ultra-transformed food and disaggregated data by gender, age, urban or rural locality, and socioeconomic indicators, all of which will undoubtedly inform decisions, spur policy reforms, provide evidence, benchmarks, and examples of best practices for tailored nutrition-sensitive programs and investments. Now, as we look into the next steps for this project, I would like to highlight some of its potential. Despite the acknowledged fact that diets have major health and environmental impacts, indicators of diet are not part of the SDG targets. Incorporating diet quality within UN reporting framework and SDG indicators has not been done partly because there isn't or there wasn't data collected routinely in all the countries using a standard adaptation procedure with consistency for international comparison. Unhealthy diets are a shared global burden, and the majority of people, including in high-income countries, are failing to even minimally adhere to the dietary guidelines. The report published today underlines that every country's average diet has strengths and weaknesses. It is highly relevant that you will discuss the insights for the US this afternoon, including on which ways diets are unhealthy, where and for which population groups. In a similar perspective, several departments across the Swiss administration have joined their expertise to allow for data collection at national level using the DQQ methodology next year. We invite other high-income countries to support data collection using this questionnaire in their own countries as a complement to existing national initiatives. Current national surveys are often more elaborate but cannot be used to track over time the collective global progress towards the goal of healthy diets and the international shifts that occur because of crises such as the pandemic or price inflation. We also encourage the diffusion of the tool and its data broadly across sectors, not only for health and nutrition departments. It could namely be used in the agricultural sector and increasingly shared with other stakeholders. For instance, civil society can be empowered to contribute to shaping processes and policies affecting them, for example, when decided which type of food should be produced by whom and for whom. Finally, as the data collected by the project has the potential to reflect climate sustainability by linking some of the food groups to greenhouse gas emissions, DQQ data could be a way to provide further evidence that sustainable, resilient, and healthy diets are a critical link between nutrition and climate change. The shift towards sustainable, climate resilient, and healthy diets will be called for at the upcoming COP27 by the Initiative on Climate and Nutrition, which states that such dietary shift would help reduce health and climate change costs by up to $1.3 trillion, while supporting food security in the face of climate change. As you can hear, we believe this project has solid perspectives for more value-adding expansions. We wish to everyone a successful continuation. Thank you very much for your attention.
So thank you once again, Dominique, for those fantastic closing remarks, and thank you to from the support of the Swiss Development Cooperation. Thank you once again to our panel members, Anna for the great presentation, and the audience, both here and virtually, for attending this event. And please join us at 2, if you can, for a deeper dive into results from the United States. Thank you very much. The meeting is now closed.